Dr. Ordo, Dr. Ray,
Good afternoon.
Hello.
Ms. Patterson, hey, Dr. Miller.
Hey, how's it going?
Good, how about you? Be careful out there.
Not too bad. I'm sitting still.
Oh,
I'm not driving.
I have 3 minutes.
Hey, good afternoon, everyone.
Good afternoon.
Hey.
Good, so I see you have your name up there as Anthony. You're not even going to make us try to pronounce your last name.
just in case, it's a little rough. Gregorio was good. Tony, that guy.
I
Right?
was definitely going to try this tonight. I was definitely going to try.
Thank you.
That last name was a character on NCIS New Orleans.
Gregorio, really?
One of
Oh,
the
no.
detectives was a woman.
Gotcha. Yeah, it's. I think it's like Italian or Spanish in origin. So yeah, and me being Filipino, I kind of
Yeah.
kind of trace the history.
I just finished watching an exciting basketball game. Boston College in Miami. Miami won at the buzzer in overtime.
Awesome.
I heard about that. Duke was able to pull out a win as well. I know UNC plays later on.
Yeah, UNC plays later on. Duke already won today. No comment. But did you see the game Saturday night?
Oh man,
I stopped watching it.
Well, it's good for the rivalry, in my opinion.
Yeah, because they've been beating us. Yeah.
Rosemary,
Yes.
I have to leave it right at 6:30. So if you see me duck out at that time, that's what's going on.
Okay.
Yep. I'll try to stay in as long as I can.
Okay. All right, great. Well, it is 5 o'clock straight up. And I'd like to call to order the meeting of the Durham County Board of Health. It is March 10th. Are there any adjustments or additions, deletions to the agenda? I'll entertain a motion.
Madam Chair, I do have.
Okay.
I do have an adjustment to the agenda, being that I have one additional amendment to present, and
Okay.
of course, the board should have received the proclamation as well.
Yes. Okay, so we'll add an additional amendment under new business. So I need a motion to approve the agenda.
So moved.
Second.
Prince Curtis.
Okay, roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Brightway, Yes. Dr. Orto,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, Dr. Gregorio, Mr.
Yes.
Gregorio.
Yes.
Thank you.
Okay. Motion is carried. Any public comments?
No, ma'am.
Okay. Any staff or program recognitions, Director Jenkins?
While I certainly want to lift up the entire public health department, each and every employee, as we begin to really slide out of the continued Omicron, slide out of that surge, I'm just so grateful to each and every one of our public health employees as they begin to set their sights on regular public health work. Specifically, Madam Chair and others, I want to really lift out our personnel in the lab. Of course, you all will be briefed on our clean inspection and success thereof, but it was just amazing to see them come together and to really be able to do all that was necessary to garner that success. But that's all I have, Madam Chair.
Okay, all right, great. So Rod, when do you want to mention the resolution?
We can do that under new
You can do
business
now.
if you like.
Yeah.
Did you want me to do it now?
Oh, yes.
Okay, I apologize.
Or if you want to do another time, that's fine.
I was going to say I was going to do it under new business.
Oh, okay, that's fine. All right, so we will move on then to our administrative reports. And so I think now we're going to hear about that wonderful CLIA inspection from Ms. Stevens.
Great, thank
There
you,
you
Chair
go.
Jackson. Good evening to the Board of Health. Thank you, Rod. We did indeed have our CLIA inspection a week later than planned. We expected it at the end of February, and then they pushed us out to the first Thursday in March, which is why we don't have the full report for you this evening, but we will have that coming next month. And I'd like to actually pass it to Josie Paul, who I believe is on, yes. As you know, having met her last month, she is our new Allied Health Division Director and hit the ground running as soon as she arrived. So I'll let her just briefly share how that inspection went.
You're muted.
My apologies. Can you hear me now?
Yes.
Okay. Good evening to the board. Good evening, Madam Chair. As Ms. Stevens mentioned, we were inspected last Thursday, March 3rd. Therefore, we had missed the deadline to submit our report on March 1st, but we will have a report at next month's meeting. I'm excited to report that our CLIA inspection was a success. We had 0 citations. 3 inspectors arrived out of, thank you. 3 inspectors arrived at about 8:45 a.m. and concluded with the inspection at about 4:15 p.m. They visited the lab and they met the staff. Mr. Jenkins, Dr. Jenks, and Ms. Stevens all met with the inspectors as well. It was a team effort. The inspectors were very thorough. At summation, they were very complimentary given the challenges that we've had to face, like COVID and a malware attack and staffing issues. I also want to point out that we've had 0 citation for 2 consecutive CLIA inspections. Thank you.
Thank you. That is great. That is truly impressive.
Thank you.
It truly is. And I'm sure y'all will keep up that good work.
We
All
will.
right.
Yes,
So we'll hear a
indeed.
little bit more about it next month after you get the report, right?
Yes.
Okay. Thank you both. Okay, so we'll move on to our budget presentation. This is always a lot of fun. So Mr. Sutton.
Thank you. Good evening, board. My name is Will Sutton. I am the Finance Administrator for the Durham County Department of Public Health. And I will be presenting our proposed FY23 budget that also includes our fee schedule changes. Let me share my screen. Let me know when you see it.
We can see it, Will.
Great. All right, let me start. So overall, first I'd like to start out with just a high level summation of what the numbers are going to say and show. So on this particular slide, I have our FY22, our current year approved budget that was in place as of July 1. This is what was approved by commissioners, and that's what was loaded into the system for FY22, a little over 29.3 million. Our proposed total for FY23 is 31.8 million, a little more than that. So it represents an increase of about, well, exactly $2,574,695. And that is reflective of a pretty much a 9% increase in the numbers. And go to the next slide. We'll get a little, hold on, here we go. On this slide, I always like to show how much the county is contributing to our budget versus what we generate internally through grant dollars, through fees, through Medicaid and commercial insurance, which is the red portion. So the blue portion represents what the county is contributing, and the red portion are those other funding sources. And so I have FY22 compared to FY23 proposed. And as you can see, county is pretty much standardly contributing 73%. There's pretty much no change from the current year to our next proposed year. And on average, that county portion ranges from about 70 to 73 on average. It kind of hangs right in there. I've seen it dip to 69, and I think I've seen one year went up to 74, but on average, this is what the county portion of the budget consists of and what we generate internally. And this particular slide is a further breakdown of the operating versus the personnel, just to give you an idea where the personnel increased a little over 1.5 million and the operating 992,000, coming to that 2.5 million increase. And I'll get into later what's driving that 2.5 million increase. Mostly it is our new spending requests that we have in the budget. But here I just want to give you a breakdown of operating and personnel. What is driving the increase? For the most part, it is the spending requests that we have in the budget. And they are ranked here. They are ranked here according to their importance based on a query of the leadership team. We are required to rank them because the budget department uses that ranking as a way of kind of gauging the importance of it. Now, of course, it's at the board, of course, has the option of moving the priorities around if they so deem. But this is how it kind of unfolded here. And I'll go through them real quickly, give you a little highlight on each one of these, because this is the main thing that's driving the increase in our budget overall. So number one, our school health nurses. Initially, we had only 4 in the request. Only 4 school health nurses. So in conversation with the budget department they were asking us, how many new positions would it take to ensure that there was a school health nurse in every school? And school health did the math, and we came back with 15. And so the budget department suggested we put the entire 15 in, and then let it be management and the Board of County Commissioners can decide if they will approve the 15, or they will lower that to another number for the next fiscal year, FY23, and maybe adding on additional positions going forward in FY24. But pretty much that cost is a little over 1.3 million for those additional school health nurses. The second priority is the community health assessment. So as you may know, that's an assessment that's done every 3 years. It's the process by which the Public Health Department, in partnership with the Duke, they conduct a door-to-door survey of community residents. In the past, volunteers were used to complete that particular assessment. And because it was volunteers, the process was a bit inefficient because it took a while to get completed. So the proposal for this year is to hire contract individuals to address that particular, door-to-door assessment. Using contract people, it can be accomplished in weeks versus instead of months, where it used to be. So that's the priority number 2 for $117,240. And in the revenue side, Duke is providing some funding to help us cover those costs in the tune of $58,500. So that's the priority number 2. Priority number 3, general inspections, lead program specialists, asking for 1 position and 1 vehicle to go with that position. So in the past 2 to 3 years, there's been a huge increase in lead work for environmental health. EPA and Department of Health and Human Services has lowered their threshold level of action for investigations. So there's been an increase in the need to monitor legacy housing in Durham County also. And there's also the Clean Water for Carolina Kids program and the requirement of sampling at all child care centers has also increased this activity. But the bottom line is that time spent managing lead issues has reduced the time spent on mandated inspections. So with this particular position, that will really alleviate time for other staff that can be focused on those mandated inspections. Number 4, reclass of an on-site program specialist. So for this particular position, the reclass is going to move the position from a registered environmental health specialist to a program specialist, with the goal of that being increased production, improving client services, as well as increase potential for employee retention by reclassing this particular position. Number 5 is our lactation-focused public health nurse specialist. Previously, that was partially funded by a grant. And these dollars are the portion of that grant that we're asking the county to cover going forward. Give you a little background, the maternal health clinic averages about 30 to 50 patients per day. As you may know, significant racial and ethical disparities are among Black and brown women can be seen in rates of initiation and duration during breastfeeding. And of course, there's also many benefits of both to the parent and the child. Since this position is currently filled, we want to continue the work with no disruptions by having the county cover the portion of the grant going forward. Moving forward, number 6, priority number 6, adding an additional processing assistant, FTE, in environmental health general inspections. This request is supported by the doubling in size of the environmental health program over the last decade and with the environmental health admin staff remaining constant at 2 individuals. So as a result, there's sometimes field staff, they have to cover front desk operations at times. And of course, this can have an adverse impact on, mandated workloads that have to be taking place, as well as customer service. Number 7, replacing 5 existing on-site water protection Ford Rangers. Current Ford Rangers are 2007 models, and the proposal is to replace those aging 2007 models with newer 2021 models. Per county policy, these vehicles are past due for replacement. So using those older models, of course, there's also always the issue of increased maintenance, and as well as gas mileage for the older vehicles versus the new vehicles, where the older vehicles, they may get probably 15 and under miles per gallon, where the newer vehicles, we're looking at probably 22 miles per gallon. And the last priority is also an environmental health under general inspections. They're requesting 2 new vehicles. And these vehicles are needed to ensure that general inspection staff have adequate transportation to complete all legacy and new requirements from the state via the quality assurance program. Team leads and section supervisor, they must observe the registered environmental health specialist inspection staff executing field duties for ethics and program uniformity. So that is the driving force between our increase in the budget this year, these particular priorities. Move forward here. Next, we're going to go into, I guess, a detailed look of the expenditure budget as a whole, focusing on the individual cost centers. We're not going to spend too much time delving into the details, but if there's some that I need to point out that may stand out that you may have questions for, like 6216 health ed, that $589,026 increase. That is a result of the receipt of the Office of Minority Health grant. It was received in between last fiscal year and this fiscal year, but that's what's driving up that number for health ed, the receipt of that Office of Minority Health grant. Other 622, increase of $102,475. That is pretty much as a result of our increase in refugee health funding. There was a pretty much a large increase that we received for AA grant 583 for refugee health funding. So that's driving the increase in immunizations. Child health 6233. There's an increase there. I did a little digging just to make sure, but the driving force behind that particular cost center is there were some positions that were initially in school health that were moving into child health, as well as a couple of grants that were also being moved from school health into child health. And personnel costs. Flex dollars this year increased. And the flex dollars, they represent the cost for our insurances, medical insurance, dental insurance, vision, where county fund employees, those insurances are covered. But if you are grant funded, you must allocate grant dollars for each person in your budget to cover all of those insurances. And the magic number that the county budget provided to us for next fiscal year to cover all those insurances was $18,159. So if you take that and by the number of employees that are in that child health cost center, all of that is driving that increase in child health 6233.
Will,
Yes.
where is environmental health in this?
Environmental health, it consists of general inspections 6241, 6244, and 6245.
Thank
It's
you.
those three particular cost centers. No problem. I want to touch on, well, let's jump to environmental health. 6241. Question.
Yes, hi there, Will. This is Anthony. Thank you so much. So just to clarify for me, the 15U school RNs, is this already baked into this particular GL, this schedule, excuse me?
Yes, it is.
It is, okay, for cost center 6236 SH, is that correct?
Yes, that's correct.
Gotcha. So that 1.32% increase, it seems like there would be a delta between that and the 15, and I'm sorry, I'm not looking at it right now, the 1.3 million increase for the 15 school RNs. What, could you speak a little bit more to that delta?
Very good eye. It's in my notes because I also wanted to explain that.
Gotcha. Thank you.
So what's offsetting that increase in the school health nurses is the movement of a lot of, there are a few other positions that were moved out of school health into child health.
Gotcha.
That is pretty much offsetting that increase that we're seeing in school health, as well as there were 2 grants and the expenditures associated with those grants also being moved into child health.
Gotcha. So that's driving 6233, 43%. Okay. Great. Thank you. And if you don't mind, also just what is it's definitely small dollars, but 6222 IMM, could you, what is that, GL?
Immunization?
Oh, immunization. Okay, great. Thank you. Which makes sense for that increase.
Okay. I might need to spell it out going forward. Okay.
Appreciate it.
No problem. General inspection 6241, that particular increase, of course, that's tied to the new spending request associated that we just went over, as well as 6244, the on-site budget. That increase is tied to those new spending requests that we just covered. And the other one that I want to point out is the population health on here. There was an increase that might stand out at you. That's pretty much related to, again, the community health assessment dollars and the new spending requests. That's the driving factor behind those. Let's move on to our revenue budget. So there are a couple on here to go over pretty briefly. I think 6216 is straightforward. That is that Office of Minority Health grant that was received. When we receive the revenue, it also increases, the expenditures on the expenditure side. So that's the increase there. Very briefly let me see.
Well, I believe Mr. Gregorio had a question.
Oh, my apologies. I'll lower my hand. Thank you.
Okay. Sorry about that.
And of course, 6233 child health. I've touched on that briefly on the expenditure side. The increase in that particular cost center, 133,295. That's the movement of those grants that were initially in school health. They're now being moved into child health. That's driving that increase. And of course, in 6250 population health, that increase of $52,444, that represents those Duke funds that they're providing to help cover the cost of the community health assessment for this year.
I had a question for you.
Yes, please.
6242 PPP, is that the government loan? Federal?
Triple
Positive Parenting Program, triple P.
Okay. Thank you.
I believe that is a completely grant funded budget. There might be some small county funds in there, but for the most part, triple P is completely grant funded. All right, moving on to our next slide. All right, we're getting into the fees. So my disclaimer is that the dental fees were included in the information that was provided in the board packet. There are additional fees that we have flushed out through a couple of meetings that have taken place since this information was prepared. And I have new slides to cover the additional fees outside of the dental here. But what we have right here is the dental changes. So as you can see, there are two new fees in dental on the top line, D1517 and D1355. The first one is replacing D1515, and I should have had that one up there too on the removed section because it's being replaced by D1517. And just FYI, I didn't put headers on this particular chart, so forgive me. So the first column would be current year fee. The middle is the change, and the third is the difference. Normally, I just present the difference, but that's what these three columns in here represent. So for the ones that did not have a comment by, there's just an increase in the fee for the year. And as you can see in the third column, those are the changes in the fee. So $11.64 for D0170, so on and so forth. And at the bottom, these are the ones that are being removed as a result of them not being performed here, D7240 and D7241. Those are the dental changes in the dental fees. Now we're getting to the new ones. Bear with me here. We'll have a new slide. Let me see if I do this right. Here we go. I hope this is big enough for everyone to see. There are a lot of fees on here, but these represent fees for the lab. First column, I put a tab column in there to show you what particular clinic the fees are associated with, and the next is the CBT code. So these are all new that are being added. And let me just give you a little background. As we went live on Epic in February of 2021. And there was a big difference between the new Epic system and the previous Patagonia system. One of those differences is if there was not a fee in Epic versus it not being in Patagonia, Patagonia will still allow them to use the fee, but it will be a zero charge. Now in Epic, if they try to use the fee that is not in there, hard error, stop. Can't do anything until you add the fee. So needless to say, we did a lot of analyzing to see what fees that we need and should be added into our Epic system going forward. And for the lab, these were the newer fees that were added to the budget. Okay, kind of straightforward, big list. Sorry about that. I hope it's visible. I'll make sure that if need be, I can send the new slides out to everyone. But this first one here, new being added for the lab. So we'll go to our next slide. All right. These are the fees that came out of our medical services division. And I want to talk about these real quickly, where there's a modifier column in here, an SL modifier. What the SL modifier means is that these particular items were supplied by the state, which means we do not charge for these particular ones. In comparison to if we privately bought or stocked these particular ones, there would be a charge for. Historically in the budget, there were just these entered with a fee, but no modifier. If we had to not charge, and we had to zero out the charge. But if we add a particular CBD code with the modifier, then we'll know that there's no charge for this particular one. So we're adding all of these to the schedule with the modifier at the zero charge. this is what this particular slide is representing. Again, some of these are only state supplied. Some of them are both state and private supplied, and there are some that are private supplied. But this helps us to track to make sure that when the item is being selected, that the modifier is added so that the charge is 0. Okay. Next slide. This is a pretty big one also. This one is representing any updates to existing fees, a change in the amount. There are a couple from the lab, a couple from medical services. What I want to focus on mostly is the pharmacy 340B ones. Now, the 340B items, we as a public health department, we were able to obtain those at a discount price. And so the price that we charge must be the same price that we acquired it for. And so it's possible that the 340B prices may change at any time throughout the year. And when they do change, they will be reflected as such. So I believe last week or just a few days ago, I was provided updates for these 340B drugs and devices. So immediately when those change, they have to be put in the system, but they're still on this particular presentation as well because they will be changed going forward in the next fiscal year also. So that's what the 340B. And if you see at the bottom here, I think it's covered up on my screen, but there's some non-340B items also that are on there. Question?
Yeah, Will, I think that those 340B prices should only change quarterly.
Oh.
So you should be able to just update those once a quarter once the government publishes those prices.
Great, great. Sounds good. And so, so another question? Go ahead.
Yes, hey there, Will. This is Anthony. I've worked with 340B prices before, so I definitely understand your pain here. Just out of curiosity, for the costs that are associated with these operational expenses, especially the ones that are supplied by the state where there are no charges, are there costs also associated to that same GL or cost center, or is it offset somewhere else?
For these right here with the SL modifier no charge?
Yes, sir. Yep.
Well, again, these are the ones that the state provides to us. So
okay,
there is no other charge associated with it.
Okay, gotcha. I just want to make sure the costs aren't associated with that same GL. Gotcha.
Updates. And let's see what is next. Okay, the removal of fees. There are just a few others that are being removed from the schedule. For most of these, it's either because they're redundant, like the environmental health one, that particular item is being covered by another line, so we didn't need this one. Or either it's a service that we're not providing anymore, such as the 76830 in med services one is not providing anymore, or is not applicable to us in the county public health anymore, or they're being replaced by another, but just a few that we're removing from the schedule also. I think that covers all the fees. So let me jump into a few additional notes to point out. Of course, you always got to talk about our jail health budget. So currently in the proposed numbers, we have a holding place for the jail health budget. The reason we have a holding place is because historically we have provided WellPath, the company that provides the services, an increase based on the medical consumer price index, which this year is 2.5%. So in the budget, we have the base amount of increase of 2.5% as a holding place. And recently, I forget if it was in February that WellPath reached out to us, and instead of wanting that 2.5% increase that we got from the medical consumer price index, they asked for a little over 8%, 8.44%, if I'm not mistaken, which is a little more than $200-some thousand. And so at that point, we reached out to our attorney, got involved, and he looked at it, and I believe he recommended to pull the interim manager at the time, Claudia Hager, into the discussion, as well as he made a suggestion that we counter that 8% increase over that standard 2.5% increase we have. So right now in the budget, there's that holding place of the 2.5%. And the difference between that 2.5% that we have there and that 8.44% is about a little over $200,000. And so that's where we are with the jail health budget.
And so, Will, when you say the attorney, are you referring to Attorney Darby?
That is correct.
That's correct.
Thank you.
Sorry about that. On another note, Bull City United and Project Build, as of, well, I guess currently and going on to the next fiscal year, they are not under the public health umbrella. So those budgets for those particular areas were not reflected in any of these numbers as in the past. So those particular areas are no longer going to be in the public health budget. They're under a new department under Joanne Pierce, one of the general managers. Just a little note there. COVID-related state grants. So right now we still have funds that are provided to us through the state for COVID funding. We have received notice that 3 of those grants in particular are going to carry forward into FY23 and perhaps beyond. And there are some that we have not received the confirmation on that any unspent funds are going to carry over. But just to assure you that we meet very periodically and working very diligently to get all of those funds from those grants spent so that we don't lose any of that funding. As of right now, we don't know the exact number of what's going to be left over at the end of this fiscal year to have already put the new number in. So as we get into the new fiscal year and we know what we have left over from those grants, then we can get that particular amount added via an agenda action form and amendment for next fiscal year. The other note is the SAMHSA grant that we recently applied for. It is a $400K per year grant that's going to cover 3 years. So, but as of right now, it's just a note. That number was not added in the budget yet. If we received some response for that grant application within the next, well, soon, I'm pretty sure the budget department will be very happy to add some additional grant dollars into our budget. But as of right now, I guess we're waiting to hear back from the application that we submitted for that particular grant. But as of right now, it's not in the numbers. It's just a note here. And that last note, fee updates, but I've already went over those additional fees. So that kind of pretty much wraps up where we are. I'll entertain any questions or concerns that you may have. Yes, Mr. Hinton.
Hi, Will. Thanks so much for the overview. I really appreciate it. Just honestly, just 2 questions. For one, just touching on the NSRs, I believe one of the items for 2244, 2244 were 5 cars for, did you say there was for border protection or?
General inspections.
General inspection. Okay, gotcha. So that wouldn't be under law enforcement. Awesome. And if I did my math correctly, I was looking at that 8.79 increase percentage wise, which represents about 2.5 million increase to FY23. If I were to take out the NSRs of 1.9 million or so, that leaves to about 680,000, or about 25% of that 8.79% increase. Would it be fair if we could just have maybe just a very simple, paragraph variance explanation of, like, the top 2 or 3 drivers of that remaining increase?
Yes, absolutely.
Awesome.
But I can already assure you that it's definitely going to be personnel increase.
Gotcha. Absolutely.
These are
Absolutely.
a major expense. But yeah, I can definitely put something together for you, no doubt.
For the FTEs. Gotcha. Thank you, Will. I really appreciate it.
All right, great. Any other questions for Mr. Sutton regarding the budget?
I have one.
Right ahead.
Yeah, Dr. Baker.
Thank you for that review again, Mr. Sutton. With regard to the vehicle replacement, are there any issues with the current vehicles besides the age and gas guzzling? I just wonder how likely it will be to get 7 new vehicles this year.
Good question. I don't know if Chris Salter is on. He may give you some additional information, but the information I was provided is, of course, the maintenance that's associated with those particular 2007 Ford trucks. And of course, there's the gas mileage. So I don't know if Chris is on, but I'm pretty sure he'd be more willing to expound a little bit more on those particular vehicles. And the probability that we'll get 7 vehicles? Good question.
Will, I'm here. When we complete the initial request for vehicles, we provide something. There was General Services receives that initial request, and there was supporting maintenance data that went along with the request form. And what's happening with these Ford Ranger pickups is there's a lot of small stuff and not so small stuff that happens throughout the year, and they go down, and we have to keep them in the shop and figure out how to get people around to get their job done in the field. And the on-site folks, you got to remember, the majority of their work is on the far-reaching perimeter of the county, because that's the unincorporated areas where you have on-site systems, the majority of the on-site systems. So there's quite a bit of travel involved in their work on a daily basis. And we've had one of those vehicles that actually it sat for a couple of months. The fact that we had continuing vacancies didn't make it such a big deal, but if we were fully staffed, it would have been a big deal. And the replacement policy is that these vehicles be replaced after 7 years in order to auction the vehicles off and get some return on your initial investment so that you can offset the cost of the new vehicles. Now these vehicles are more than 15 years old, and they're going to have major problems. And they're having some what could be considered major problems, but they're going to have more. I don't know if that answers your question.
It does. Thank you. Also, I just know it's difficult to get vehicles this year, especially. Hope that you can get them.
Yeah. Your point is that you can't find the vehicles. That's correct, because they're not on the lots because of the chip crisis. Yeah, I understand.
And just to touch base on the probability of us receiving the vehicles, or the probability of us receiving all of our requests, that always a factor to consider is, what are all the requests that the budget department is receiving from all of the departments, and what's the, what's that gonna look like? Of course, historically, well, I was gonna say historically, in an effort to I guess, be fair and allocate dollars, if we ask for X number, we might receive a less number, or something to that effect. but it's kind of from a historical standpoint.
Okay, thank you very much.
All right.
Any other questions or comments regarding the budget? Okay, so will you need a vote to approve?
Yes.
So we'll entertain a motion to approve the budget for FY 22-23.
Motion.
Second.
Roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Wright,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, Mr. Gregorio.
Yes.
Thank you.
Okay, motion carries. Thank you, Mr. Sutton. That was good information and detailed. Thank you so much. All right, we need to go back. My apologies. We did not review the minutes and approve the minutes. So hopefully you had a time to review them. They were sent in your mailings. So we'll need a motion to approve the minutes of our last meeting.
Motion.
Second.
Roll call vote.
Commission Chair Jackson,
Yes.
Dr. Miller,
Yes.
Mr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Wright,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, Mr. Gregorio.
Yes.
Thank you.
Okay, the motion carries. All right, so we'll move down to item 7, Board of Health questions regarding the vacancy report. Any comments or questions? I do have one quick question, I guess either for environmental health or maybe Attorney Wardell. So that first entry, that Cheek Road property that we've been working with since 2016, it looks like. So they were sent 2 demand letters. The last one was in January. So what would be the next step with that now?
So the Cheek Road case, I believe we had to send out a new demand letter because we went to asserting the actual administrative fees in our demand. And so that would give them time to respond. And if they didn't respond, then we would apply administrative fees on that as well. So the next step is to file a lawsuit. And once we file a lawsuit, then we'll get to seek injunctive relief and to enforce the administrative fines as well. What we found, and Cheek Road is one of several that we have sent out new demand letters because we wanted to put the provision in for the administrative fees. Typically, once they receive that demand letter and we put a figure in there for administrative fees, then the property owner responds and we get it resolved. As a matter of fact, I was going to give a report on 213 Snow Hill Road, which we in fact did file a lawsuit on, and we got an entry of default, and we filed our motion for entry of default judgment this week. So that is one that will be resolved, fairly quickly. There are 2 attorneys involved in that. So you'll see on the report, there may be multiple demand letters that the cases. Usually we had the initial demand letter, we didn't get a response. We wanted to make sure that we got the administrative fees in there because we just recently, within the last year, decided well, really last 6 to 8 months, decided to pursue the administrative fees. So you might see another demand letter. And so
Okay.
that starts the clock over again. They get the chance to respond, so forth and so on. So the next step is to file a lawsuit and to pursue that. Now, with these environmental health issues, the remedy is you vacate the premises. You can get pump and haul if you can afford that. Or you can get a system that is approved, a discharging system that's approved by the state. So the last option really isn't an option because you got to have a free flowing water source, which is like a stream or something of that sort. And most people don't have that. So that's no longer really an option. So really the only two options are abandonment or pump and haul. If there is the possibility of a repair permit, then that is an option. But we've been finding that the soils in our particular area and the lots are not receptive to that anymore. And given the new standards, they're just not receptive. So we have to gauge the will of the county to put people out of their houses. And for the last 2 years, the will was very, there was no real desire to do that. I'll just say that, okay? And there was also a moratorium on evictions. I think we could have gotten around that moratorium on evictions, but though we could have got around it legally, I think it probably would have been a problem from a political and social standpoint. So some of those may seem like they have been lingering for a while, but we're working through the list. The more serious ones we have filed, and we are pursuing. That Cheek Road property has been a thorn in our sides for a while. So it may in fact get elevated to the next level, fairly soon. Once we resolve the 213 Snow Hill Road matter, that may be the next one on the list.
Okay. All right, great. Thank you for that. All right. And vacancy report. I guess, were there any comments or questions about that? I just noticed that over the past 5 months, I think it is, we've been pretty steady at 16% vacancy rate. So at least it's not going up, and hopefully it will slowly come down. Any questions or comments regarding the health director's report? Okay, there were some nice activities in there. I did want to give kudos to environmental health for their work with a product that was recalled regarding baby food that was infected with the bacteria. And environmental health, they did a great job getting out to all of the child care centers and informing folk and taking care of that, and some of the long-term centers as well. So thanks to Chris and his people for that. And I love that dental fair too, that you had free dental services for the kids. All right, item number 8. So in our operating procedure manuals, it states that we're to have an operating procedure committee of 3 people that will review it annually. Now, in the past, what we have done is just review it annually at one of our meetings. But we went over our entire operating manual, and we're going to talk about that in item number 9. But I want to go right now and give kudos to the personnel committee, who actually took on the role of an operating procedures committee, because that one change we needed to make in how we report complaints turned into a review of the whole procedure manual. And many thanks to Attorney Wardell for that, for helping us with that entire review. So having said that, now I am going to retroactively appoint a operating procedures manual, and that in essence is actually the personnel committee. So that will consist of Dr. Braithwaite, Dr. Miller, Dr. Orto, And who's the fourth person?
Dr. McDougall?
McDougall, I'm sorry. Took me, yeah, and he got just appointed to the Personnel Committee. So those are the folk on the Operating Procedures Manual. So for next year, there'll be an appointment for an Operating Procedures Manual that will not be also the Personnel Committee. But thank you so much to the Personnel Committee for taking that on for us. So now we will move on under old business to the revisions made in that Operating Procedures Manual, and that was sent out to you the other day. So hopefully you had a chance to review that. Dr. Braithwaite.
Good evening, everyone. Hopefully you have a chance to take a look at the revisions proposed by the committee to the Operating Procedures Manual. And we want to thank attorneys Everett Perry and Brian Wardell for working on this. And Attorney Wardell he combed through the entire thing and made some recommendations. And Attorney Everett Perry also helped us with the new portion, which is item number 7 on the procedures. So are there any questions about the revisions? There are a few things I just want to point out. We revised Attorney Wardell suggested that we clarify that the first meeting of the year is not necessarily in January, but it's first meeting of the calendar year. Also clarified the committees and enumerated those. We also clarified quorum and voting and abstentions. So it's good to review that. We are not able to abstain from a vote. We must vote or recuse ourselves if there is a reason to have a recusal. And then number 7 is specifically in handling complaints, which we reviewed in more detail at our last meeting. Attorney Wardell, did you want to highlight or discuss anything, especially about the voting aspect?
No, I think it's pretty straightforward. The prior personnel document allowed for recusals and abstentions that weren't necessarily allowed by state law. You cannot abstain from voting. You can only recuse yourself if you got an actual conflict of interest. And if you have a conflict of interest, then you have to recuse yourself, and then your vote is not counted. And you're also not counted toward a quorum. And so some of those things just needed to be spelled out. We've never had, I think once I can recall, someone wanted to abstain from voting. And we just advised them that they couldn't abstain. But other than that, it's really not an issue. And if someone has a direct conflict, they just tell everyone, and then they're not involved in the deliberation on that particular issue. So it hasn't really been a problem. But since we are tasked to review the policies every year, might as well update it while we're doing it now. So I think things are in good order now. And then, of course, there was the portion that was added with the assistance of HR and myself. There were just a few tweaks in there as well. But I think they're also very straightforward things that have been discussed by the Personnel Committee and the board.
Okay, all right, great, thank you. Any other comments or questions regarding the Operating Procedure Manual? If not, I'll entertain a motion to approve.
Sure.
Second.
Okay, it's been moved and seconded. Roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Mr.
Yes.
Gregorio.
Yes.
Thank you.
Okay, motion carries. The Operating procedure manual is approved. And thanks again to the personnel committee for taking that on. That was certainly not planned that way, but they took it on, no complaints, and did a great job. So thank you. And to you again, to Attorney Wardell. Okay, Director Jenkins, our COVID update.
Madam Chair and members of the board, we're going to have a COVID update from our illustrious medical director, Dr. Jeff Jenkins.
Oh, great.
Thanks, Rod. Let me try to share my screen here. This is the hardest part.
It is.
Doesn't look like you can see it yet.
I think we accidentally gave Mr. Gregorio.
Yeah.
All right, so now we're
I just made a mess.
Okay, please send it back. Thank you.
Good.
Thank you so
Okay.
much.
Okay. Can you all see this?
Yes.
Okay, great. Thank you, Chair Jackson. It's always nice being the bearer of good news. I think there's going to be a lot of good news in this update. Because the CDC metrics are a little bit confusing, I did want to talk a little bit about the old and the new CDC COVID metrics, and then just give some recent updates on trends here in Durham, and then just a little bit about vaccine updates. So the old CDC metrics looked at COVID cases per 100,000 population in the previous 7 days, as well as percent lab positivity. And anything above 50 cases per 100,000 in the previous 7 days, or percent lab positivity above 8%, the CDC considered substantial or high transmission. And that was kind of the trigger for continuing the mask mandate. So you can see here, our goals were, obviously we wanted to, get into the low level of transmission, but really our kind of triggers as far as the masking was getting into the moderate level as far as cases, and then the low level incentive in terms of percent lab positivity. And you can see here, just looking at the old metrics, this is what kind of North Carolina looks like today.
I'm not sure.
Yeah, we still have the cover slide.
Still have the cover slide. Oh, it's advancing on my screen, sorry. Can you see that now?
Yes.
Okay, sorry about that. So this is kind of a table of the old CDC metrics. So, this would be kind of the trigger for moderate transmission, getting below 50 cases per 100,000 per 7 days, and then lab positivity less than 5%. And you can see here, this is, if we were using the old metrics, this would be what North Carolina looks like today. And still see, would be a lot of areas of high or substantial transmission, including Durham County. We would still be considered high. So the CDC came out with some new metrics about 2 weeks ago, and with the idea that, there's more to just cases and lab positivity, especially, given high background immunization rates, as well as, really quite a substantial portion of the population infected, and then with, at least temporary primary immunity. There are estimates that 40 to 50% of the US population has had COVID, and obviously that immunity can come and go depending on, the duration of immunity, but kind of given those couple factors, and the fact that, really, if you're vaccinated, if you've got primary immunity and you get COVID, for the most part, people have pretty mild illness. The CDC thought, and to me, this makes good sense, looking at other metrics, including, hospitalization rates, as well as hospital staffing, which has been a problem, particularly over the past, 6 to 12 months. And so they really are, they're continuing, and we're continuing to look at cases per 100,000 in the previous 7 days, but now looking at more intently, new COVID admissions per 100,000 population in the previous 7 days, as well as hospital staffing. And, although the CDC has kind of rolled out these new metrics over the past couple of weeks, these are metrics we've been keeping an eye on. We just weren't kind of focusing on them as much as the cases and the lab positivity. So you can see here, this is kind of the way these metrics are interpreted. So the way I look at this, I first look at COVID cases. Are they greater than 200 or less than 200 per 100,000 in the previous 7 days? And then I look at new COVID admissions and staffing. And as far as the mask trigger, we wanted to be in the medium or the low, and obviously, we want to be in the low, kind of the low tier. So these are our updated metrics from today. So our cases per 100,000 over the previous 7 days is 128. So we're below that 200 number. And then new COVID admissions per 100,000 population in the previous 7 days, we're at 4.7, which is well below the 10 kind of threshold that we'd look at to be in the low transmission kind of quartile. And then percent staff beds, we're at 6.8%, again, below the 10 threshold. So we are, despite what I don't know if you've looked at the CDC map recently, it hasn't been updated since March 4th. It still has us in the medium level, but we are now in the low level, which is really great. And we've, really, this happened pretty quickly. We went from high to low really in the past week and a half, 2 weeks. And so we're really sitting in pretty good shape. So the recommendations, if you're in the low tier, really are stay up to date in your COVID vaccines, get tested if you have symptoms. They don't have any specific masking recommendations short of if you're in a healthcare setting or on public transportation, you should remain masked. Still, I think if you're someone who has an underlying medical condition, you're on an immunosuppressant, other factors that may kind of increase your risk for getting COVID, still may not be a bad idea to wear masks in certain situations. But according to the CDC guidance, really, we're in pretty good shape as far as, for the general population, indoor masking. And this is really, kind of the underlying reason why we discussed with the, county commissioners and the mayor and recommended, lifting the mask mandate Sunday at midnight. This map is not updated. This is still about a week old, but we're still in the yellow tier, although we should be green now, and a number of these other states should be green. I'm hoping they update this map within the next day or two. And here you can see just this really dramatic decline in cases over the past 3 to 4 weeks. From a huge peak here. We're really back down to near our baseline between the Delta and the Omicron surges. And then as far as hospitalizations, you can see here, 7-day moving averages come down really nicely. There's still some people, with COVID in the hospital. Some of those folks, if you're admitted to the intensive care unit, unfortunately, you can be there for weeks. And so I think this downward trajectories, it's a little bit higher than, our 7-day moving average, just because there are, unfortunately, some people that are in the hospital and will be for a while. You can see ICU admissions are coming down nicely too. Just a couple updates on vaccines. We're still vaccinating the general public Monday through Friday, including kids over the age of 5 and giving adolescents boosters. As I haven't heard any new updates from the FDA as far as vaccines for those under the age of 5. Hopefully that may happen in April, although I think that's to be determined. And we're actually going to be, downsizing our vaccine operation. The people coming in for vaccines has really slowed. And so we're going to be downsizing to some degree, but we'll still have an active vaccine clinic for the foreseeable future. And then just some updated numbers from this morning. So about 67% of Durham is fully vaccinated, and you can see kind of the distribution here is in terms of race: 61% white, 50% Black or African American, 75% Asian, and 64%, almost 64% Hispanic or Latinx. So just kind of in conclusion, we are doing really great as far as cases and hospitalizations in our metrics. We're now in that low tier. For most people, if you feel comfortable, you don't have to wear a mask indoors, except for in healthcare settings, public transportation, or long-term care settings. And, despite the fact that we're doing so well, we are going to be keeping an eye on the metrics I discussed, as well as other metrics that the state's looking at, syndromic surveillance and wastewater surveillance, just in case, a new variant, comes along, we'll be kind of ready to ramp up operations if needed. So that's a kind of a quick update. I wanted to leave some time for questions. If, folks have any questions, happy to answer them.
Just one quick question, Dr. Jenks. So fully vaccinated now, we're talking 2 doses of Pfizer, Moderna, and 1 of Johnson & Johnson. And
That's still.
So how are we doing with boosters in the county?
Boosters, it varies by age group. I don't think I have the information pulled up, but I think, those over 50, I'm guessing a little bit here, but I think it's around 50 or 55%. And those over 70, I think we're up near between 60 to 70%. I'm just ballparking though.
Okay.
The younger age cohorts are definitely lagging behind. It's hard, especially when, cases are decreasing, to continue, for people to feel the urgency to continue to stay updated.
Okay. I think that any other questions or comments?
Thank you for that, Dr. Jenks.
Sure.
Yes.
I remain hopeful that we can find creative ways to continue to try to vaccinate, because we do have some vulnerable populations that remain unvaccinated and unboosted.
And if this becomes endemic and perhaps seasonal, like, a lot of people are predicting, we are going to need to keep our foot on the pedal as far as, maintaining high vaccination rates, or, we could run into problems again. So that is going to be I think the big challenge going forward.
All right, thank you. Any other comments or questions?
Dr. Jenks, if you would return the host permissions back.
Oh, yes.
To Durham County Public Health, please.
Stop. Trying to figure out how I'll stop sharing here.
Go over into the participants.
So I'm under share screen here. You can tell I'm technologically challenged.
That's okay. Go over into click on the participants.
Okay.
To click on more.
More.
You're going to have to highlight it. Just touch your screen, your mouse.
Oh, here I am. Okay.
And then make Durham County Public Health the host.
I don't have that option. I have pin spotlight for everyone and rename under more.
Okay, when you click on more, you should see everybody. You should be able to see my name, Durham County Public Health.
I wonder if I leave and come back, if that will unshare, because I'm not seeing that. Let me try to leave. Okay, there we go. I think that worked.
Okay. Okay, you're still the host.
I'll be there in a moment, Dr. James.
Okay, I'm going to log out and hopefully that'll do the trick.
Chair Jackson, we can still move on.
Yes, yeah. Okay, so they'll get that done. So under new business, Director Jenkins, I know you wanted to bring forth information about a resolution that you want to do, and then we have the budget amendments and ratifications.
Yes, ma'am, Madam Chair. And once again, good evening to this great board. At a recent strategic planning retreat for the North Carolina Public Health Association that I was fortunate to attend, a number of matters came up. We're talking about how the public health workforce throughout the country is just kind of under attack, public health workers, I mean, both physically and verbally. And we thought it not robbery to really form this template. So our Board of County Commissioners and Boards of Health could recognize the great work that public health does in anticipation of National Public Health Week, which is April 4th through the 10th. So I did seek permission from the chair to raise this matter. And special thanks to Rosalind, who was went ahead and crafted the proclamation or resolution, I should say. And at this time, I do believe you all received it, and we want to present it for discussion.
Yeah, we did receive it, and I read through it. It sounds good. It's powerful. It really characterizes what public health does and what the people who work in public health do for their communities. So I'm happy that this came up and that we're doing this for them.
At this time, Madam Chair, I request a motion to move forward with this recommendation from the Board of Health to present this proclamation to the Board of County Commissioners in recognition of public health.
So moved.
Second.
Okay, it's been moved in second. Roll call vote.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Brightway,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, Mr. Gregorio.
Yes.
Thank you.
Okay,
so much.
motion carries. Yes.
Thank
and I'm
y'all so
sure
much.
The county commissioners will approve it as well. So great. That's something. Are we having some big celebration next month?
We're going to do our very best. I know we've begun some pre-planning, so we certainly want to make sure that we celebrate this awesome workforce.
Yeah. Okay, great. Thank you. All right, carry on.
Under budget ratification, we did have an ordinance amendment to recognize $25,000 from the North Carolina Department of Health and Human Services Division of Public Health for comprehensive suicide prevention. Our health education team, under the leadership of Lindsay Bickers-Bach and Willa Robinson, wanted to petition for this. And it is timely. The Board of County Commissioners are really wanting information about suicide prevention and also gun safety. They have charged us to really track the metrics and really get more involved with the community. And we look forward to doing it. So we have this one for your consideration. Did you want me to just continue on, Madam Chair?
Yeah, then we can do them together.
Okay. Under amendments, we are going to really step out there, if you will. We are seeking the approval of a Matthews Specialty Vehicle contract for a new mobile medical unit totaling $341,864. This is something I'm personally excited about because as you all know and probably have seen us last year, we were out in force doing our COVID vaccine outreach. And the entire time we kept thinking how nice it would be to have a vehicle that could be a one-stop shop to get into all the nook and crannies from Rougemont to South Durham. So we have these COVID funds and it is a permissible expense. The team has invited folks from General Services and Procurement to join us, and we've received permission to move forward with this. And this is certainly something that we are excited about. We do believe they'll take anywhere from 12 to 18 months from start to finish. But we're patient, and we certainly will have it in complement with our dental van, which is kind of around the same make and model. So we have that for consideration. And finally, we do have a budget ordinance amendment to recognize $262,706 from the North Carolina Division of Public Health, Women's and Children's Health Section, Children and Youth Branch. These funds, once again, are for COVID-19 support, and it's really for the purpose of forming a COVID support team whose members will be a part of a school-based health team to collaborate with school health programs to provide COVID-19 support. Madam Chair, that's all we have.
Okay. Any questions or comments regarding those amendments and ratification? That is exciting about the vehicle. Yeah. All right. If there are no questions for Director Jenkins, I'll entertain a motion to approve.
So moved.
Second.
Okay, roll call vote.
Are we doing all together, or are we doing budget ratifications?
No, we're doing all together.
Okay,
Ratification and amendment.
okay. Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Mr. Gregorio.
Yes.
Thank you.
Okay, motion carries. Thank you, Director Jenkins. All right, agenda items for next meeting. We're going to hear from Clea again.
Did we say we?
Yeah, Madam Vice Chair, I know you did ask us for something. I'm trying to remember what it was.
Yeah, I was going to talk about that in informal discussion.
Refugee health.
Oh, yes, yes.
We got that teed up for you. Thank you.
Thank you.
Yeah, those would be great. That'll be good. Those two will be good. Give us a little break. We'll have a shorter meeting next month. But it's all good information that we need. Okay. So refugee health and our CLEAR report. So under informal discussion, I did have one thing I wanted to throw out there, and I've talked to some of you about this a little bit already, and that is about pivoting back to in-person meetings with the numbers improving. We recently went back to our monthly meetings, and so we need to discuss when and how to go back inside and meet together. And I can finally meet some of you that I never met. So what are your thoughts on that? Now, Director Jenkins and I talked a little bit, and I actually talked to Roz some too. So I know the space that we normally used is still being used for some COVID activities. So how are we with that, Rod? So what do you think? Are we able to, as you all downsize some of the activities?
We will endeavor to make accommodations available to you. We have also consulted with Marcia Richardson, our IT Director for Public Health, and she is going to ensure that we have those technologies available for those who may not be able to make it and still be able to present virtually. We will ensure that we have enough spacing to accommodate social distancing. So, we'll be able to take care of that. Just so you know, Madam Chair, members of the board, I did ping the Social Services Board, and Public Health leads the way because Social Services has not really thought about it just yet. And they meet next week. So we are beating them to the punch. But they have indicated that the chair she too is interested in in-person meetings.
Okay. All right. So then it sounds like we will be able to have our April meeting, at least as a hybrid. Okay.
So I will say this, you have the option of having a live meeting or a virtual meeting because we're still under the state of emergency for the state. It gets a little tricky if you want to have a hybrid meeting.
Okay.
So since we are still under a state of emergency, you could either, you can alternate live and then maybe the next month have virtual. But if you want to have a hybrid, then that gets really a little bit complicated in terms of what you have to have in terms of streaming, in terms of accessibility by those who aren't there.
Yeah, Roz and I did talk about that a little bit too. I wondered about that. Okay,
Right. So my recommendation would be to either rotate, have a live meeting, have a virtual meeting, or to just go all the way live again. And if you go all the way live, you just social distance, and everything is as it was.
Right. Okay. Well, Mr. Anthony, you have your hand up.
Hey, Dr. Jackson. I just wanted to say that I do travel a lot for my job as well. I'm definitely going to plan as much as I possibly can in advance to be in person in Durham for our meetings, but I just wanted to put it out there. If for whatever reason, if I have to be remote, then certainly I'll let you all know that I'll be absent to the meeting.
Okay. All right. No worries. We'll talk about that. Okay. Well, I'm thinking let's do this then. If you all agree, let's meet virtually next month. In May, we'll meet in person, period. How about that?
Good
plan.
Okay. All right. Thanks, Attorney Wardell, for that.
No worries.
All right. Okay, y'all, we're almost there. Okay, next on the agenda. I will need a motion to adjourn into closed session pursuant to North Carolina General Statute 143-381.11. Parentheses A, parentheses 3 and 6, to consult with an attorney employed or retained by the County of Durham to preserve the attorney-client privilege and to discuss a personnel matter.
Second.
Okay,
I'm sorry,
it's been,
who did the motion?
Dr. Ray.
Thank you.
okay. So the first part of the closed
to do a
session will be
Roll
an
call.
executive session. Okay, I'm sorry. Roll call to pass the motion.
Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes.
Dr. Wright,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Mr. Gregorio.
Yes.
All right, if you guys would give me a minute to get you guys over to the next break room, please.
Okay. And this first part will be an executive session with just the board members. And then Director Jenkins is going to join us. And I'll call you on your cell when we're ready.
Okay, well, the break
Or do I
room
need
is
to call you, Roz? To
yes,
bring back
yes,
in?
ma'am, because the
Yeah,
break
call
room is
Roz to bring you
already
back
set
in.
up with everybody. So
Okay.
they're gonna have to, the folk who don't need to be there will need to leave, just leave and then come back in.
Okay.
Okay, right now, Anthony should be there, Attorney Wardell, Dr. Ray, Josh, Dr. Braithwaite, Dr. Jackson, Dr. Orto, is everybody there? Hey, Dr. Miller. Dr. Miller?
Hey, Rosalind, are you there?
Yes, I'm here. Do you need to be in the break room?
Yeah, I lost my connection to it.
Okay. Do you want me to put you back in there?
Hang on a second. Can you say it again?
Do you want me to put you back in there?
Yeah, if you could. I don't know what happened and I don't know how to get back in.
Okay, I just sent you back over there.
Hey, Rosalind,
Yes, sir.
my phone died and now I'm on my computer. Can you put me back in? I don't want to miss any of this.
Okay. Okay, Dr. Jackson, who made the motion to reconvene back into regular session?
It was Spence and seconded by Braithwaite.
Okay, thank you.
That was to seal the minutes.
Oh, that was the sealed minutes. Oh, I'm sorry, Orto and Gregorio. Orto made the motion to reconvene and Gregorio seconded.
All right. Attorney Wardell, do we need to do a roll call for the reconvening or not?
That was already done in
Yes,
closed.
sir. Okay.
Yeah.
All right, thank you.
So we need a motion to adjourn. Open meeting.
Motion to adjourn.
Second.
Okay, Chair Jackson,
Yes.
Dr. Miller,
Yes.
Dr. McDougall, Mr. Curtis,
Yes.
Dr. Braithwaite,
Yes.
Dr. Orto,
Yes. Yes.
Dr. Ray,
Yes.
Mr. Brown,
Yes.
Commissioner Alam, and Mr. Gregorio.
Yes.
Thank you.
All right. Motion carries. We're done. Enjoy the rest of your evening.
Thanks,
Make sure
everyone.
Thank
Make
you.
sure you cheer UNC on tonight at 9:30.
Go Duke, go Duke.
Duke already won today.